Hi, my name's Kevin Kirk. I'm an orthopedic surgeon at TSAOG Orthopedics and Spine. My wife and I are actually board members of the Lone Star chapter of the Cystic Fibrosis Foundation. And this year, we're fortunate enough to be co-chairpersons of the Tower Climb, which is now the Stadium Climb. Cystic fibrosis is a genetic disease that affects the lungs, the pancreas, and your digestive system. What happens with CF is that the channels in your body make thick mucus, which clogs up your lungs, which predisposes you to respiratory infections. It also can block your ducts in your pancreas and your gut that makes absorbing food difficult. Well, everybody's journey with cystic fibrosis is a little bit different. When Andrew was born in 1997, it was pretty dire. The life expectancy of a child born at that point in time was probably in the early 30s. And so we were really saddened because he seemed to have a little bit rougher course, particularly early on in life, in which he required IV antibiotics at least once or twice a year, with hospitalizations for about 2 weeks at a time. And also daily, like most cystic fibrosis patients, you're required to take a multiple number of pills for digestive enzymes, also antibiotics to kind of help ward off infections. And then there's the daily respiratory treatments to kind of keep the lungs moving forward to kind of prevent that mucus buildup. But fortunately, over time, with the advances in the science and some of the new medicines funded by the Cystic Fibrosis Foundation, the course of his life has changed. And so with Trikafta, which just became available, it's really kind of kept him out of the hospital. In fact, he hasn't been in the hospital for over 5 years. His pulmonary function tests have improved almost to completely normal when they were about 50 to 60% before Trikafta. And so this money that we raise through the Cystic Fibrosis Foundation really buys the science, that buys these medicines. And so the course of a child that is born with cystic fibrosis now will be significantly different than Andrew's. And so that's why we're so passionate about trying to raise these funds, because we know that there's a cure just around the corner. And the more we can raise the money to buy the science, the more kids and young adults that we can save and have a better lifestyle. In fact, most recently, they said the median age is close to 50 for somebody who has cystic fibrosis. And so we're ecstatic that, our son will live a pretty normal life at this point in time. So this would have been the 37th annual Tower Climb at the Tower of Americas. However, as everybody knows, the last 2 years have been anything but normal. And so because of the restrictions and the spread of COVID in our community, in order to be safe, the Tower Climb has moved to the Stadium Climb over at Heroes Stadium. So we get the same amount of steps, but just in a different venue to be a little bit safer for not only the patients with cystic fibrosis, but everybody who wants to be involved. So there's really two ways, but most important is about raising the money. So if you'd like to participate in person, which I know is a personal decision, you can sign up at fightcf.cff.org online. But you can also donate money online. The donation of the money will go to the same place, no matter if you participate in person or sign up online. And so I really encourage you to donate. And that's really critical for finding the final cure for this devastating disease.